Hey guys, it's Mo from Mo in the Deep End, and we're trying something a little different today because, well, this case, and we're doing the defense open for this little bit. And let's be honest, we're going to listen to the hospital explain how they did not one thing wrong. And I'm probably gonna have some rage fits, so I figured let's keep my hands busy. Let's do some cross stitch while we listen to this hospital explainerate how they did nothing wrong and they were the good guys and they were just trying to be nice and helped Maya and they did nothing wrong. So I decided to break out the cross stitch, see how this camera thing was going to work so I don't, lose my mind and start, over gesticulating and raging out. I'll wait for some more people to get in and come watch. But yeah, that's what I figured I'd do today since it's Friday. And I figured I'd be a little ragey rage since I'd have to watch the defense explain how it is that they did nothing whatsoever wrong. John Hopkins, was trying their best, which I highly doubt. As I said, I will be all the bias and the petty on this case. I think John Hopkins, again, when they put in the pick line, as we heard in the defense's kind of discombobulated sort of opening, or not the defense, the plaintiff's discombobulated opening, they knew early on when they put in the pick line when she was under the care of other specialists prior to them accusing the parents of, particularly Beata, the mother, of having Munchausen by proxy. They put in the pick line in order for Maya to have easier access to the ketamine treatments. Uh, you know, they put it in with knowledge that she had CRPS. So I needed to have something to do with my hands to keep from completely raging out, if you will. So, and Fry wanted to go outside with the boys and have fun. It's cooler, but it's fun outside. It's muddy, it's wet, it's rainy ish, uh, foggy. Boys want to go outside. They do not want to stay inside and watch trials. So we will get started on this. I'm sure Boss Hog, who I have playfully named this human man person who is defending uh, the, well, John Hopkins Hospital, whom I can only assume uh, also plays like an evil genius, like on the side. I don't understand the glasses on the top of the head. I'm not a fan, but let's start and see how this goes.
Good morning, almost afternoon. My name is Howard Hunter.
I already don't
and
like
I have
you,
the
sir.
privilege of representing Johns
Oh, sorry. I'm trying
Hopkins All Children's Hospital and the people who staff it and who make it. We're here today to defend this case, and we appreciate the time and energy that you have put into this effort thus far. You're the most important people here. And we appreciate
stop
your
buttering up the
attention.
jury.
We appreciate your commitment
Hello, T. Reed.
both to the trial process and to the process of waiting until you've heard all the evidence before you make a decision or begin to formulate a decision. With me today, first of all, let me introduce my team. With me today are my co-counsels, Pat Crowells, Ethan Shapiro, David Hughes. We also have today a representative from Johns Hopkins All Children's Hospital, Dr. Anthony Napolitano. See it over there. Dr. Napolitano may or may not.
Thank you, Thierry. I appreciate it.
Seeing you as a witness as well. You'll see doctors rotating as corporate representatives during the trial.
He means corporate ass covers. I mean, representatives.
Being part of the effort to defend the hospital in this matter. The hospital, after all, is not just a big pile of bricks and mortar. It's the doctors and nurses and people and professionals who run it. And so we're here representing them, although I'll be referring to the institution generally, for brevity's sake, as either ACH or All Children's Hospital. I mean, you may hear Johns Hopkins occasionally, but I've been representing them for a long time, long before they were Johns Hopkins. This is a case that has a number of different facets to it. And the circumstances and facts that I'm about to discuss with you constitute our view of the evidence. You've just heard Mr. Anderson tell you their view. I'm about to tell you ours. Judges told you, and it's absolutely correct, that what you hear from me is not evidence. It's my view of what the evidence will show. This case involves a number of different facts that occurred over about 18 to 24 months. I can't cover
18 to 24 months, almost 2 years of her life screwed the hell up. I can't, y'all. I mean, as I said, I generally try to be objective, but this is ridiculous. I understand that he is covering the hospital's ass. I understand the liability. I understand the intense amount of litigation that hospitals come under. Hey, Christine, with frivolous lawsuits, with people that are there like, oh, with the, ambulance chasers and the people that are legitimately out to make a buck for, ridiculous things. I get that he genuinely has a job to do with people that want to file frivolous lawsuits. This is not that to me, but that is my opinion.
cover all the details in 90 minutes. And if I did, both you and I would have our heads swimming from the effort. So I'm going to go over some high points. I'm going to discuss some matters that Mr. Anderson touched upon. And I'm going to ask your indulgence as we fill in the blanks over the next several weeks. This sequence of events began on October 7th, 2017. That's where the plaintiff's case against Johns Hopkins began. Before that, you're going to hear a good bit of evidence about what went before. You're going to hear about the development of Maya Kowalski's disease process. You're going to hear about where else she sought care. You're going to hear a lot about the details of that care and a lot about the problems with it. I'm going to cover some of those in just a moment. The point is, for now, that as of October 7th of 2016, Kowalski's had been to Johns Hopkins several times. They had entrusted Maya Kowalski's care to us on several different occasions. And in doing so, they had come up from their home in Venice, past Sarasota Memorial, a number of other hospitals, and sought out care from All Children's. Presumably, we vindicated their trust in doing that, and they came
Not
back
sure.
to see us on October 7th. We had no
I
reason
think you can do a
to
live
wish
stream
this
at any
family harm,
time,
and we still
sweetie.
don't. Indeed, there's a tragic outcome in this case in terms of Mrs. Kowalski's suicide, and we regret very much that happened.
I hope you're
The
having
issue
a
here,
good day as
however,
well.
is
I know
who's
that Nicholas
responsible for it.
streams on, so
We're going to go over the facts of that
I hope everyone
and
is
what
on
the
the
facts
replay
don't
crew.
show in terms of any connection between what was done by All Children's and that tragic result.
Oh, screw
Now,
you.
as
Screw you sideways. No connection, excuse my French. With a rusty trombone. Are you kidding me? There was absolutely no connection to the car crash and the crash dummy broken. We found no connection. The government has investigated itself and found itself awesome. You're welcome. It takes a certain kind of brass set of twig and berrylets to say that with a straight face, but okay, sir.
As of October 7th, we had the Kowalskis seeking out care at All Children's, as I've said. We believe the evidence is going to show you that care was reasonable and necessary and appropriate. And indeed, we're going to suggest to you the evidence I'm about to discuss with you will show that what went before, the treatment that went before, did not necessarily fall into that category. Any of those three categories.
Mm-hmm.
That is the reason, one of the big reasons that we're here today. Now, as of this date, as of the time that Maya Kowalski was discharged from All Children's, we believe that in fact, she had been set on a path of therapy that has enabled her to resume function, to get out of a wheelchair, to be relatively pain-free, and to be in a situation of participating in her school and in society as she does today. So how did we get there? Well, on October 7th, Maya Kowalski was brought to the emergency room at All Children's. As you've heard, she had bad stomach pain. She was screaming, crying, thrashing around, cursing at staff, very upset, and presenting a very challenging situation for the staff. She had pain in all her extremities. She had her whole body being said to be hypersensitive to any kind of touch. She was unable to walk. She had legs atrophied from disuse, from being in a wheelchair for months at that point, or maybe over a year. She had dystonia, alleged dystonia, different position of her feet, as you've heard.
Alleged.
And she was demanding pain medication in large quantities. Mrs. Kowalski arrived a while later, and you're going to hear that when she arrived, she forbade the doctors and the nurses to touch Maya. The doctor,
because it flippin' hurts. It flipping hurts to be touched. What I will explain to you, it's weird to see your hands moving when you do that. So Mr. Mo has had to remove a blanket because a blanket hurts. He's had to shut a window because a breeze hurts. That's the level of hurt there is. That's the level that I think Maya will have to get up and testify, because that's what people don't get. Beata going in and saying, "Do not touch my daughter," isn't because she's going in there to be a hyper, C word. It is because it hurts to even have a skirt on at some point. I mean, I have to wear it because obviously you can't be naked, but it hurts to even have my skin on it at some points. If I'm having a very bad day, everything hurts. A breeze will hurt. Air hurts. I mean, that is the level of pain that you have. You just want to be knocked out. You just want something. You just need something. You are a cup that's overflowing with you cannot handle one more sensation. You feel like you are going to crawl out of your own skin with the pain, and her demanding that they don't touch her at that level of pain is because I can't describe, as I said, in my earlier thing, imagine instead of like someone just doing this, you feel someone scraping an open wound with sandpaper. When you're having a terribly bad day, This touch feels like that on your affected limb. If her whole body is in the hypersensitive, that's what it feels like. So, yes, if Beata went in and said, do not touch my daughter, that is why. So, hopefully, that gives you guys a little bit of a, again, the way he is presenting it, I can understand how it can come across like that. What I am trying to give you guys is information and understanding as to, yes, it probably did come off as, why is this, 10-year-old demanding ketamine and, Demerol and all these other things? And why is this mother saying, don't touch my child? And, this, that, and the other. I mean, it probably comes off as very odd. So hopefully having me try to explain it gives a little more context to what's going on and helps explain things. Again, I can see from the hospital's point of view how, but having to live it, it really pisses me off because they are in Florida right next to the RSD Foundation, the Reflex Sympathetic Dystrophy Foundation, the number one foundation of this in the world. Um, it's not like they were without any sort of facilities where they could have gotten this knowledge.
The doctors and the nurses wanted to assess her, to examine her, to put on a blood pressure cuff,
You
to put on an
can't.
O2 sat monitor, to take a temperature, and they wanted to find out why there was all this horrible stomach pain. Was it appendicitis? Was it a torsion of the intestines? Was there something badly wrong that an ultrasound or a flat plate of the abdomen or a CT scan could detect?
Okay, we're gonna
Those questions were
stop
being
this
asked.
right here real quick
Mrs. Kowalski insisted.
because this is what, let me see if I can pull it up. Oh, I forgot I moved my thing to make it a little. I was told to print this up. Let me see if I can pull it up for you guys because this is what I was told to have ready to go because medical areas are so completely ridiculous about this. They don't know, which again, it's a fairly, don't like seeing, for now, remove. Okay, so I have a copy of this. I need to get a couple more laminated, but I have it extras in my car. But they recommend that if you do have CRPS or they used to call it RSD, you have this because emergency rooms do not know what to do with you. They don't understand it. They don't. That's why I have my emergency bracelet that basically just says, don't touch my left leg. But bring your contact information. I don't have a letter from my pain specialist, but basically don't have ice, avoid touching me, request warm blankets, have the hospital have clean sheets, soft sheets, have your family members bring in your own sheets. If possible, have a sign put up and designated where your limb is affected. Make sure that phlebotomy only, touches non-affected limbs. Avoid needle stick injuries as far as possible. Combine blood tests of any things. Make sure that the thinnest needle is used. You can ask for topical numbing creams, different things. Again, just they have different things that they ask that they've, made a whole new paper for that I'm sure Beata probably had, knowing how on top of things she was, she probably had this. these are the things that irritate me. So she probably had this. Hello. So she probably had this particular piece of paper. She probably had the protocol. And again, this is from, let me see, again, so this is from 2014. They've made a whole new one. It has a much more in there, but it explained, the one I have is a lot newer, but there's also, a bunch more about, not touching lesion sites, not, what is allodynia, the things like that, where they're painful for touch, where there might be mirroring, all these other things, explaining what it actually is. For medical people who are not familiar with this, if you have to go into the emergency room, there are newer things. I have some printed out. I just failed to actually bring one up today. But the RSDA is one of the RSD Foundation is right in Tampa. And it ticks me off that the hospital that was right in Tampa or right in Florida is fighting them again. So hopefully, as I'm going through this, I can kind of give you both sides from the hospital. I can genuinely understand from the hospital. I know, as much as I said I was going to be all full on petty, I can understand from the hospital side why they would be very confused about Maya's mother going in there and saying, "Do not touch my daughter, do not touch her," and Maya asking for pain medication, that those would set off alarms. But again, if they would have taken 5 seconds to ask the mother about this, if they had looked at the protocol, which I'm sure the mother had because she was on top of things, and she probably had it from the doctors along with notes and everything else saying, "This is what she has. This is why you can't touch her." Because again, as I, just let me pull this camera up so you can see a little better. This that I'm doing right here, if she is in that much pain, just doing this, imagine sandpaper on an open wound. I am not exaggerating. I'm not joking. On a bad pain day, if there is a breeze on my leg, that's enough to send me into a full body spasm sometimes. Like, Mr. Mo has had to come in. I've had to text him and say, "Can you please shut the window?" Or, "I need you to remove this blanket. I can't have it on me anymore." Sometimes he's even had to help me. I mean, this is embarrassing, but, take the skirt off of that leg. So when she says, "You cannot touch my daughter," that's the reason. It's not, "Hey, I've done something nefarious and you can't, and my daughter just wants all the ketamines." That's not it. That's really not it. There's a reason, um, that, again, and as much as I said I'm trying to be petty, I can understand why the hospital was like, "What the actual crap?" I mean, this girl's screaming, she's cursing us out. It's really hard to be in that amount of pain and be a kind, genial person. So I can understand why a 10-year-old was not being the best patient. And I can understand why the mom was, going into full mama bear mode. So I can see both sides of it, but I don't understand why from that point, after she explained things, maybe after she gave them the paperwork, after they went through her records, it escalated. That's the point I don't get. So let's continue.
Insisted that before there be any workup of the child, she wanted ketamine. Now, not just any amount of ketamine. You're going to hear a lot about ketamine in this trial. Ketamine is indeed an old drug, and it's a drug that is approved by the FDA for use as an anesthetic. It is not approved for use in children, nor is it approved for use in high doses as treatment for CRPS or chronic pain. That's one of the issues here. It's not just ketamine itself, but how it was used and the quantity in which it was used. Because ketamine is an anesthetic, it is an hallucinogen, it can create dependency, it can cause depression.
I'm going to
of
stop
vital
you right
signs.
there, sir.
If not properly monitored.
What the hell is she on right now? Because I'm going to guess she's on some sort of opiate, isn't she? I'm going to guess she's on some sort of opiate or a spinal stimulator or something that you've got to kick back on Big Pharma. I'm going to guess that you didn't want her on, any sort of Delta 8. You didn't want her on medical marijuana. You didn't want her on anything, kratom or anything like that. I bet you did want her on, don't play that with me, sir. Because the first thing I was thrown was, all those good, narcotics that, y'all are so worried that everyone's going to get daggone addicted to. But that is the only thing that you can throw CRPS patients is a lifelong dependency on narcotics. So if ketamine is shown to work by the RSD Foundation, who did a study on it, then, okay, all right. I'll try to
It
stop
can cause
cussing.
serious injury, life-endangering consequences. Mrs. Kowalski on this day was challenging the staff to give her daughter a dose of 1,500 milligrams of ketamine. That is a big dose. That dose you're going to hear is several times, many times, the maximum dose that Policies et al. Children's approved. You're going to hear experts tell you that is many times any kind of safe dose. And you're going to hear the ER doctor who was on duty that day, Dr. Layla Behar Posey, who you're here for by deposition because unfortunately she's no longer with us. And I mean that in this life. She'll appear by deposition, and in her deposition, you will hear her tell you what she did and why she did it. And you'll hear her tell you most pertinently that even if she was so inclined to give that much ketamine in the emergency room where she didn't have sufficient monitoring availability, she didn't have the capacity for long-term wake up and intubation. For that period of time, she didn't have the facility she needed to do that. Even if she was inclined to give it, which she wasn't, she couldn't safely do it in that setting. Now you're going to see.
Oh, crap. Sorry.
That Dr. Behar Posey is not just a newbie out of medical school. You'll hear in her deposition what her qualifications are. You'll hear that she's board certified in pediatrics as well as emergency medicine. She's confronted.
Is she certified in CRPS? That is the issue. It's not that she is not qualified. It's not that she's not learned. It is not any of those things. It is that she does not understand the very difficult, the very complex, which is why it's in the name, storm and kind of galaxy of symptoms and difficulties that a patient with complex regional pain syndrome has. Again, Maya's is full body. Mine is just in my leg. I can't imagine a full body involved complex regional pain syndrome. And she's probably never been confronted with it. Again, I think only 1 million people on Earth or in America have it. So most medical professionals will learn about this and then basically forget about it because they're never confronted with it. So the protocols, everything you have to do with it, everything, you completely forget it. It's ridiculous.
Confronted a lot of patients, difficult patients, patients in extreme pain. You're going to hear that this patient, as far as she was concerned, had some degree of uniqueness in that she'd never seen anything quite like this, and she'd never heard of these doses of ketamine. What she found out ultimately, and what developed over the next few days, and actually the next few weeks, is that Maya Kowalski had been given thousands, tens of thousands of milligrams of ketamine over the preceding 9 months. Her doctor, Dr. Hannah, had given her the day before admission 1,250 milligrams of ketamine. And at that time, he's going to testify to you that he told the mother he was no longer comfortable giving that much ketamine, that it was too much for him to give in his outpatient clinic. And he actually sent her to All Children's. You're going to hear that over the 9 months preceding this, that he had given her a gradually increasing doses of ketamine, 12, 15, over 20 milligrams per kilogram per hour, which is dozens of times the safe and effective dose that was approved by the hospital and that is talked about by the FDA, and that it's never been written up in the literature. You'll hear Dr. Hannah say, either by deposition or by admission on that witness stand, that this was at or near the highest per capita dosage he had ever given any patient. It wasn't working. So what had happened was that he had maxed out with this ketamine dosage. He had sent her to All Children's, and Mrs. Kowalski, despite what he had told her, despite what had happened over the last 9 months, was demanding even more. Dr. Posey heard this.
How dare this mother ask her daughter to be out of pain with something that had worked before? How dare her?
Story from the mother. She heard how much ketamine that the mother said Dr. Hannah was giving. She heard what the mother was demanding. She saw what was going on with this child. She'll tell you what her suspicions were about the child's condition and what was actually causing it. But she called Dr. Hannah's office herself. Now, she learned that he gave 1,250 milligrams. She learned what else had happened the day before. And so she decided that she would attempt to stabilize the child. She literally she'll tell you about literally negotiating with the mother to give a small dose of ketamine and some sedative, to conduct an examination, to admit the child to the pediatric intensive care unit. You'll hear it called the PICU. And the idea that she had at that time was, let's get her in the PICU, let's get her evaluated by pain management, let's see what's really going on here, let's get her stabilized, and then let's see if we can wean her down off all this medication she's been given. So she admitted her to the PICU. And Maya Kowalski was taken up to the PICU floor. And that process, in fact, began after consultations were placed by the PICU staff to have her see anesthesiology, pain management, and psychiatry, as well as to do some more diagnostic studies and blood work. So what was being done here at this point? What was reasonably prudent with what these physicians knew and what they knew it? What was happening was that they had a child being given levels of medication that they had never heard of before, that the literature did not support, that the literature didn't even mention. And so they put her in a safe environment. They attempted to get her stabilized. They called the correct consultations, and they tried to investigate what was going on. We will suggest to you, the evidence will suggest, and the experts will say that that was a perfectly reasonable thing to do. There's no conspiracy here. It was an effort to safeguard this child and to see that she got appropriate therapy going forward, whatever
Oh my
that happened to
God.
be.
I need to get a screenshot of this. How do I do that? How do I do that? But the death eyes she is giving him right now. All right. I love these death eyes. But she's like, all of the bullshit. This is all of the bullshit. And excuse my French. This is much more of a cursey stream than normal. I'm going to try to keep the F bomb out of it, but definitely BS might be called a lot. But yeah, this is all the BS. But Maya definitely disagrees that she was given a safe environment when they left her in a room to soil herself for no reason.
Now, you'll hear that the admission diagnosis that was recognized at that time by Dr. Behar Posey and ultimately by Dr. Teta Sanchez was CRPS, chronic regional pain syndrome. There were other suspicions, and you'll hear about those too. But for now, I want you to focus on what CRPS allegedly has as its features, according to Dr. Kirkpatrick and what you've just heard from Mr. Anderson. It's lifelong. It's incurable. It can wax and wane. It can return at any time for any reason or no reason at all. It can cause a whole host of symptoms. And according to Dr. Kirkpatrick, who's the one who diagnosed it to begin with, it's incurable. It's always going to recur. It always requires ketamine. Now,
if this man says it's curable, I will come out my chair.
Wanted to try alternative therapy first and had some regard for what the previous doctors had done. We're going to invite you to listen to the evidence about that and to look at the evidence about that, see how much was done, how much was actually attempted. We believe the evidence is going to be that that wasn't something that was given a really fair, appropriate trial before ketamine was used. You're going to see, ultimately, Dr. Kirkpatrick, when this child was in the hospital in October and November of 2016, told Mrs. Kowalski that unless Maya Kowalski got more of his ketamine treatments, more of these high doses, she would die a slow and painful death. Well, thankfully, he was wrong, or has been wrong so far. And we think he will continue to be wrong. At this point, it's well to walk the clock back a little bit. I want to ask you to look at the evidence as you receive it on a comparative basis with these ideas in mind. You're going to hear, and you heard already, some recording from Dr. Kirkpatrick's first visit with Maya Kowalski and her family in September 23rd to be exact, of 2015. I want to focus for a minute on her condition at that time, what the evidence will show that. She was wheelchair bound. Her legs had atrophied. You saw the picture that Mr. Anderson showed you. Her legs and arms were hypersensitive to touch. She had limited use of motion of her arms due to pain. You're going to see more of that. You're going to hear about pain in other parts of her body, alleged dystonia. She wasn't in school. She wasn't functional.
Alleged.
She couldn't walk. She couldn't do her own ADLs. She had no normal function at that time. you're going to hear evidence that she came to that point from several admissions, primarily for asthma at All Children's, but they also concerned a number of admissions at other institutions. Now, Mr. Anderson has mentioned to you what the evidence is going to show about Lurie Children's Hospital, where she was taken by Mr. and Mrs. Kowalski, Tampa General Hospital, Sarasota Memorial Hospital. She had been seen as an outpatient by the First Physicians Group here in Sarasota, the Sarasota Memorial Group. She had seen some physicians from Lee County. There was over 40 specialists that she had seen before she found her way to Dr. Kirkpatrick's office. And all of those specialists, many.
And you wonder why the mom is trying to is begging the doctors to listen to her because she could know what the hell is going on with our child. She could know what the hell is going on with her child. Yes, I may have said some cursey words. That's why I'm doing cross stitch so that I don't punch my computer screen. Because he's like, we fixed her. You should have seen the dagger eyes that Maya gave him. He's like, and I can tell you right now that we have fixed her and she's leading a wonderful life. And just, oh my God, the amount of dagger eyes. But yeah, he's basically shit on the diagnosis, pooped on the amount of drugs that she was taking. Oh yeah, no, you're okay. That's fine. No, you're fine. But yeah, just, basically the mom was demanding that they not touch her, and I had to explain kind of why you wouldn't want to do that. So it's all the rage.
Many of those specialists that weren't concerned primarily with asthma felt that in her presentation, some of them were seeing her for asthma, felt that in her presentation, there was some psychogenic component of some sort. And there were words like conversion disorder, psychological component.
Oh.
There was even one at that early point who was concerned about Munchausen by proxy. What I'm suggesting to you is All Children's didn't blaze this trail. We just walked it. We found it on our own, but we walked it. So did these other folks, all 40 of them. And actually, remember, there's about 48. The point is that was not an unreasonable thing for Johns Hopkins to ultimately come around to believing and come around to suspecting, because many others had suspected the same thing. The recommendations for treatment of this disease, of the diseases that were suspected before Dr. Kirkpatrick, were physical therapy, psychological and cognitive behavioral therapy, sustained, long-term, intensive. That was back then. That's pretty much the therapy that Dr. Kirkpatrick rejected because he began the course of ketamine. When Dr. Kirkpatrick saw her on September 23rd, you'll hear him say, I believe. He didn't care what the other doctors said. He didn't care what the records showed. He didn't review their records. He never contacted them. He never talked to them. There was no discussion.
Oh,
in which
you're right there.
He said, gee, I think it's this. I'm a specialist in this. You're a specialist in pediatrics. Let's reconcile our differences of opinion. Didn't do that. Instead, he diagnosed chronic regional pain syndrome. He's the first one to do it. And he began therapy, ketamine therapy. Now, you heard counsel talk about what the evidence is going to show Dr. Kirkpatrick did. Dr. Kirkpatrick will say in this courtroom or by deposition 1 that he began this child on a 4-day treatment of high dose ketamine, what he considered to be high dose. You're going to hear, incidentally, that Dr. Hannah's high doses were multiple times what she was given by Dr. Kirkpatrick. He gave her 4 consecutive days of ketamine, and his records say that there was minimal effect. Minimal effect. He used opioids and narcotics to try to control her pain after those treatments. And we believe the evidence will show that as a result of those things, she wound up at All Children's Hospital with stomach pain and horrendous constipation. That was going to happen again and again following large doses of ketamine and other drugs. She was being harmed by these things. But in September and then in October, when Dr. Kirkpatrick treated her with high-dose ketamine, he prescribed more yet. And so she went to Mexico to see Dr. Cantu. I'm glad to hear Dr. Cantu is going to be here. Dr. Cantu, in his deposition, described to us what his regimen of ketamine consisted of down in Monterey. It's a treatment that is not approved in this country. He developed it from a trial in Germany. He'll tell you that. It contemplates giving the patient 7 to up to 9 milligrams per kilogram per hour for several days and keeping them in a coma with intubation for that period of time.
Yes.
He's going to tell you that it's a risky procedure. He's going to tell you that he tells his patients that there is a 50% risk of death from that procedure. Now he's going to say he's never lost anybody, but listen to the cross-examination of Dr. Cantu about the dangers of that treatment, the degree of ketamine that was used, how it was used, and what his expectations of success were, because those expectations were not realized. And that's a key factor.
You take those notes, Maya.
What happened here is that this child was given the same thing over and over and over and over again in increasing quantities, and it didn't work. And the first thing that didn't ultimately work was Dr. Cantu's treatment. She had to go back down to Mexico for a ketamine booster. Dr. Cantu will tell you that that's fairly usual, that happens, and that then he expects them to be pain-free for a number of weeks or months. Listen to what Dr. Cantu tells you about whether he knew anything about what happened after this. Because what happened after this was Maya Kowalski was taken back to this country. She was taken to see Dr. Hannah. Dr. Hannah embarked on a course of ketamine treatment beginning in January of 2016 and extending to the door of All Children on October 7th, 2016. 9 months of therapy, 55 treatments, an average of 1 a week or more. 55 treatments of ketamine.
I want you to keep in mind that what the plaintiff told you about steroids in her system, eating the ketamine. So again, also you get used to ketamine in your system. So what this defense is also not reminding you of is that your body will build a tolerance. Also, the ketamine isn't being used for pain relief. It is right now what they think the ketamine does, especially in CRPS, is, Lord, I'm all discombobulated. But let me move things. Let me get the board of truth out. Let me get this up and ta-da. All righty. You get to see my knees. Like I'm not even cosplaying a Pentecostal rite today. Now, they are pooping all over Dr. Kilpatrick, but he is actually part of the RSD Foundation, I believe. But he's been studying complex regional pain syndrome, or RSD, reflex sympathetic dystrophy, for a long time. So here is your brain with the little doodly bit, and it goes down to your spine, and then it branches out to all the little nervy things. And say you get hurt over here, and so this is the pain signal over here, and it loops up, and you get pain, and then it sends it back down, and you usually stop doing whatever stupid thing you were going to do that's causing you pain. Well, in complex regional pain syndrome, this loop is just endless. So it just never shuts off. Now, what they think that the ketamine does, and again, complex regional pain syndrome has, or RDS, has had very little research. There's so many things that are involved. They believe there's so many systems and kind of different things involved, different systematics, different genes, they think, different just idiosyncrasies in the body, that they are quite unsure. But they believe that the ketamine actually resets this pain loop somehow, but it's not permanent. So they have to redo it every once in a while. So the major dose redoes it for a while, but then you have to continue to redo kind of the reset. And if she's on steroids and it's already eating up her bloodstream, what I think is going to happen is that he is going to I think Maya is going to be able to explain, because again, you are going to have this, everything he's saying makes sense. Everything he's saying sounds quite logical, quite understandable, quite, again, it sounds easy to understand. Why are you giving this kid all of this medicine? Why are you doing this? You can understand the hospital's point of view. It really makes a lot of sense from the hospital's point of view. And he doesn't have 873 post-it notes, 973 papers like the plaintiff had, which, oh my gosh, I about lost my mind with the plaintiff's lawyer, because he was all discombobulated and, like telling jokes, which was fine, but his notes.
Turn on another movie.
Yes, he may turn on another movie. I'm finishing this, and then we'll do something. Yes, the judge did deny access. She was not given a hug, and then she was, the mom was basically not allowed a hug at the last hearing. The judge felt it would be not appropriate at the time. And Beata went home and unalived herself. Now, at this time, the husband and Beata were not at a great place in their marriage. So, and I believe that the husband was being pressured by the police, like, look, you can get your daughter back, but you kind of have to disavow your wife. You have to disavow your wife. You have to, you're either with your daughter or you're with your wife at this point. So he kind of said, look, I just want my daughter back. I'll do whatever, and I think Maya's mom probably felt like, I can't do anything. She probably just felt at her very lowest point. So she did unalive herself right after that. So I'm sure the guilt that the husband feels is, I'm sure, unimaginable. And I can't even imagine.
Multiple times in excess, not just of what the doses recommended by the manufacturers were, not just in excess of those, not just in excess of Johns Hopkins All Children's policy multiple times in excess of what Dr. Kirkpatrick gave, multiple times in excess of what Dr. Cantu gave. You may even hear Dr. Cantu admit that he wouldn't give those doses in the circumstances that
May.
Dr. Hanna did. You may hear him say that he never gave them, period. But all those doses of ketamine and all that therapy and all those drugs over that 9 months, over that 13 months, we're going to ask you to look at the evidence and look at what the evidence shows about the result. The evidence shows that as of this, October 7th, 2016, once again, Maya Kowalski is wheelchair bound. She's hypersensitive. She's unable to use her arms and legs. She's got chronic extreme complaints of pain. She's got leg atrophy and said to have dystonia. And in that year, incidentally, she gained 4 pounds. Think about that. You're going to hear more about that because Dr. Hanna will tell you that he recognized that his patient was malnourished. Over that period of time, over a year, she gained 4 pounds. Now, she also, at All Children's, was on 21 different medications as of October 7th, 2016. 21 different medications. Let's compare for a moment what the evidence shows regarding Maya Kowalski's condition at the time of her first appointment with Dr. Kirkpatrick and the time she's admitted to All Children's a year later. You can see the slide. The evidence will show that she was in essentially the same condition with one addition. In addition to the problem she was having when she saw Dr. Kirkpatrick back in September 2015.
Because when you're in a lot of pain, you don't want to eat. I mean, the fact is you can do a lot of therapy. You can do desensitized. Therapy does help. I'm not going to lie. Every morning I get up and regardless of how I feel, I, take a shower, which doesn't sound like it's a big thing, but, letting the water run on my leg, shaving, is something that I do, running a towel on my leg, working on my range of motion, working on walking, doing stretches. These are all things that I'm doing daily just to make sure I've got that range of motion and things like that, regardless of whether I want to or not. I mean, these are things that I have to do. I'm working up my courage to go to the local Y and try to do some water aerobics. The thing is that I don't have access right now to a therapy pool. We have a lap pool at our Y. Lap pools and like swimming pools are kept at about 70 to 80 degrees because they don't want you to get, thank you, Bobby Baloney. They don't want you to get too hot when you're actually working out. Now, therapy pools are kept from 90 to 100 to sometimes a little bit hotter because, again, you want to relax. They want you to, sometimes you can do Achi or water therapy. They'll have you float. They'll sometimes have someone manipulate you in the water. That's a lot of what I used to do. So I'm working up my courage to do that because I know that it's going to be a lot of sensation and stimulation on that leg, and it will probably send me over for the first couple times I do it. And then I'll probably get used to that sensation and I can do more. But it's that initial gearing up to it. It's like when you know something is going to it's like going into labor, you know it's gonna just suck all the balls, but you get a good kid out of it, you know? It's great, but you get a kid out of it, which is awesome, but you still have to do it. So it's working my courage up to do that because I know that I'll probably need Mr. Mo with me because once I get in and out of the pool, I'll probably be needing help walking out of the Y and things like that. So it's a devastating disease when it affects your whole body, and, that's really pretty rare, at least as far as I know, it's usually one limb, but it's definitely the way he's presenting it, again, the way they're doing full on cover your own ass. Yeah, she is malnourished, again, had I'm sure what they're treating her with right now is some sort of opioid, is my guess, or they have her on, gabapentin or Lyrica, which are also considered controlled substances because they're, usually used for epilepsy or, uh yeah, they're for neuralgia. They're
In
nerve
addition, she
medicines,
was malnourished.
but okay.
You'll also hear evidence that during that same period of time, there were 3 occasions, October 7th was the 4th, when she was in the emergency room complaining of extreme stomach pain following doses, high doses of ketamine and other drugs. We suggest to you the evidence will show that she was being harmed by these large doses of medication. The evidence will show you that the doctor's concern about how much she was being given placed down
Oh,
to 3.
sorry.
Evidence will show that she was being harmed by these large doses of medication. The evidence will show you that the doctor's concern about how much she was being given and the frequency with which she was being given it was very well placed and is vindicated by what happened later. Let's take that comparison one step further. We believe the evidence is going to show you that between the time that Maya Kowalski was seen on October 7th in the ACH emergency room and the time she was discharged 3 months later, she had gained 4.5 pounds, which is more than she had gained in net weight gain in the last year before admission. She was still in a wheelchair, but she wasn't complaining of extreme pain constantly. She was comfortable. She was using her arms, and we believe she was improved.
Or was she lying to get the hell out? Was she lying to get the hell out of jail? Was she like, "I'll do anything and say anything to get the hell out"?
There'll be evidence you hear from the witness stand about her condition at the time of discharge versus her condition at the time of admission. But perhaps more telling is the condition under which she was discharged. At that time,
Oh, you mean with a dead mom?
she went from 21 medications down to 3. And at that time,
Oh, hell no.
she began a course of physical therapy and counseling that, by the following school year, had her back in school. That was pretty much the regimen that was recommended for her at All Children's. That was pretty much the regimen that could have been given her earlier and sustained and perhaps saved her a lot of anguish and pain and perhaps this lawsuit.
Fuck you. Don't you dare insult her dead mother for doing what she thought she was doing right by her daughter. How absolutely dare you, sir? And I am sorry for cursing and using the F word when I promised I wouldn't. But I cannot and will not listen to this smugly ass little man or big man, I don't care, boss hog, ridiculous man sit here and judge a dead mother who took her daughter to no less than 48 different specialists trying to figure out what the hell was causing her so much pain. They saw results. They saw results. Nothing was helping. And then you took her away from her family, tortured this child. And then when the child just finally said, "Fine, fine, I'll do whatever you say. Can I go home? I've already lost my mom." And then you have the smugly nerve to sit there and say, "Well, had they just done this in the first place, then she would have just been fine in the first place." Can I tell you, she is probably sitting there in pain and just hiding it because you guys have made any other option non-negotiable so that she could stay home with her dad, so that she could stay home with her brother. I, for the life of me, cannot understand the arrogance of this that last sentence, sir. You could have had an entire argument and not added that sentence. That was a dick asshole move. That's a son of a bitch move, and you should have just left that out of there.
She got her physical therapy. She got counseling. Pain medications were withdrawn. You may very well hear that to this day she's on no pain medication.
Because you probably
Now, you
told her
heard it
she couldn't
suggested
have
by
it.
counsel that she couldn't take ketamine. Indeed, when she was discharged, the court, court of this circuit, not this judge,
Objection.
What basis? What's the legal basis?
Oh, you're racist.
Motion eliminate.
I don't recall that one.
Okay, we're backinating. Okay, I don't know how to take a screenshot. Dang it. Okay, wait. I know. You're a racist. What's the legal basis? Motion lemonade. Hey, Sal, anyone? Someone, hey, Sal, if you're on here, can you take a screenshot of this? Because I need your racist legal motion lemonade, if possible. Just for God bless you, closed captioning, for pulling me out of my rage spiral. Thank you, Sal.
Motion eliminate.
I don't recall that one. Continue.
directed her discharge. She could not be discharged without an order of the court. And she was discharged with
Sal.
instructions as to what medication she could have at that time. She could not have ketamine. She could not have heavy analgesics without the court's intervention. That matter was dismissed several months later after she did well in her father's custody. And she's free to get whatever she wants today.
No, she's
For the
not.
present, let me
No,
just mention that.
No, she's not. No, she's not. Because here's the thing. She is scared to death still. She's only 17. She's not. She is scared to flippin' death that you guys are going to come in at any point if she has a setback, if she has a flare. So what she's doing right now is she is toughing it out. She is waiting and counting down the days until she is 18 and can get something that will help her with her pain. That's what she's doing. I can almost guarantee it. You smug little butthole with glasses on your head, boss hog, ridiculous man. For the president, just let me mention this. Listen, what she is doing is waiting until no one from the state can tell her what the hell to do. and she doesn't have to worry about being ripped from her father and put into custody again. That's what she's waiting for. Not that she's doing great and she's just super duper fine. How obtuse and ridiculous can you be? Read a room, sir.
Mention this. I'll deal more with it. You're going to hear a lot more about it. Once the court entered an order following a report of child abuse that she was to be sheltered at All Children's under the custody of the Department of Children and Families, All Children's Hospital did not have the ability to discharge her without court approval, even if it wanted to. You're going to hear evidence. You can hear evidence from DCF personnel who will tell you we're the ones that set the visitation parameters. We're the ones that decreed who she could see, when she could see them, what she could have in her room, what she would have access to. The hospital, unfortunately, was put in the position of having to implement those orders. That's what we tried to do. But throughout this case, we're going to ask you to try to avoid conflating what was done by the court or ordered by the court with what was done by the hospital.
You're all dead.
Because the hospital's not the court. The hospital's not DCF. The
I
hospital has
charge
to
you
follow
all.
that. And the hospital doesn't institute that. The court and DCF do. Now, I digressed a little bit there, but I want you to pay attention, I'm sure you will, to what the evidence will show regarding Maya Kowalski's condition today. If she's not at the head of her class at Venice High School, she's real close. She served in her
Okay.
student government. She works.
I'm gonna pull a Will Smith, but keep Maya's name out your mouth. Thank you, Holly. I mean, does anyone else feel like I'm ready to pull a Will Smith. I feel like he needs to keep Maya's name out his mouth. I really do. I mean, I've never been a violent-ish person. Maybe it's the extra red hair dye. Maybe I went too red this time. But I truly do feel like he needs to keep Maya's name out his mouth.
She works out. She's on track to get a high school diploma and an AA degree on time. She's dating. She's functioning. She walks unassisted. She's not taking pain medication. To some appearance, she's doing very well, and we hope it stays that way. Now let's walk back the clock once again to October 7th, 2017. At that time, we described what happened in the emergency room. You're going to hear more about that from nurse witnesses. Maya Kowalski was admitted to the PICU. We talked about that. Dr. Beatrice Tepa Sanchez was the one on duty that night. You'll see what her credentials were. She'll tell you what her credentials are and her board certification in pediatrics and intensive medicine. She will tell you that what she did was attempt to understand what was going on with this child. And you'll see her and you'll hear her walk through her admission history and physical and the research that she did into the records that were available to her at All Children's of previous encounters. You'll see her discharge summary, and you'll see the care that she took to track down what this patient's history was. And you'll see that when she did that, and she was able to get the child admitted and sedated and started stabilizing, that she did call appropriate consultations. She did get pain management and anesthesiology involved. She did call psychiatry. And because of her concern, you'll hear that she also called a pediatric child abuse expert, Dr. Sally Smith. You'll hear Dr. Smith is the head, the medical director.
She's the head
Of
of
the
the boil on the
Child
butt of
Protection
humanity.
Team, CPT, for DCF, the Division of Family Services, excuse me,
The Division of
Department
Losing
Children and
Children.
Families.
Y'all don't want the stats on how
I
many
just gave away
children Florida DCF has lost. Sorry, I went super salty and petty after I watched. I don't know who Fry is running after in his dreams, but I think he just caught them, and he also farted while he caught them. And good Lord, what the heck did he eat?
Gave away my age, by the way. They used to call it the 70s. But in any event, you'll hear she contacted Dr. Smith to say, basically, I'm not sure what's going on here. Can you check this out? And you'll hear that Dr. Smith did. You'll hear that Dr. Smith was not an employee of All Children's Hospital, that she was not part of the treatment team, but she was there as a resource. And you'll see over time, and we'll talk about this again in a minute, the investigation that she conducted in connection with her duties with DCF and the Child Protection Team. She was not an employee of All Children's and never held herself out as such. And you may hear from Mr. and Mrs. Kowalski themselves that they knew that from day one. Now, I mentioned that Dr. Sanchez got her colleagues involved. One of those colleagues you'll hear from is Dr. Richard Elliott. Dr. Elliott is a board certified anesthesiology in pediatrics. He will be here and testify about what he found, what his interactions.
Thank you
with
all for
Mrs.
joining
Kowalski
me on
were,
Petty
and
Highway.
how he believed this child needed to be weaned off of high dose medication and weaned off of the regimen that she had been on. You'll also hear from Dr. Jenny Dolan. She's in the same discipline. She too had interactions. And you'll hear from both those doctors that during the time they were caring for this patient, they were having a problem with what Mrs. Kowalski wanted. Mrs. Kowalski wanted an intrathecal pain pump placed in her daughter's spine to deliver a medication called clonidine, powerful drug, into her spinal canal. She was told that was a bad idea by the doctors at All Children's. She was told the same thing by doctors at Nemours. Indeed, you're going to hear Dr. Kirkpatrick tell her that's a bad idea. She was insistent upon asking for that over and over. She was talking about taking her daughter back to Mexico and Italy for more high-dose ketamine that she had just come off of, and that the doctors at All Children's felt weren't working. And frankly, we would suggest to you the evidence suggests weren't working. The
You
plan
take
of
those
care
notes.
the doctors wanted to pursue.
Here's the thing. The mom has been with this child through the entire 3 years of trying to find answers. So she has the entire medical history with her. She has she has medical knowledge. She has a medical career. So these doctors who have not been with Maya the entire way, you know, only have bits and pieces. Yes, they have their expertise. Yes, they have this and that, but they've not seen the entire evolution of this medical history. That's why, so when I used to work at the physical therapy aquatic pool, our intake, uh, patient intake, initial appointment would take about 2 hours because by the time people came to us, they had such a galaxy. They had been through 2 or 3 years of, this doesn't work. This doesn't work. I've seen my doctor for fibromyalgia. I finally got diagnosed with this. I've tried this. I've tried the injections. I've tried this. I've tried that. So we go through and we'd have to go through and we did, actual range of motion with, it's this little, I'm going to trigger you all. I'm using a lip gloss and a pen but it's a little thing that has it's called a goniometer, but it basically does angular measurements of the joint to see how much range of motion you have at each joint. We would take pictures, things like that, to actually get real concrete evidence of what we were able to achieve. We did a gait evaluation to see if you pronate or how your gait training was, if you were able to stand up or sit down assisted, just different things about your body so that we could kind of work holistically. That was at least the idea. So while these doctors all have these little bits and pieces, again, so they might think they have the greatest ideas, and maybe the mother was completely wrong. Okay, maybe, she was wrong. She's still a mom who just wanted to help her kid, just wanted to help her, just wanted her child out of pain. And these doctors were like, no, she's our kid now. And forced this child to, because look, I can almost guarantee you, as a person that has this, it doesn't go away. It doesn't go in remission. And I swear to God, if one of their doctors says, yeah, you can put it in remission, it goes away. We figured out how to heal it. When prevailing medical information that I've looked at, it doesn't. Okay. Then she's biding her time until she turns 18, and no one can take her away from her dad if she chooses to get pain medication that helps her. That's what she is doing. At least that is my opinion. I could be wrong.
Was consultation, weaning of the medications, appropriate care, and ultimately transfer. Now, I'm going to go past the slide on Dr. Smith here and go fast forward here because I want to talk about several specific
No,
allegations.
why don't they want
that
to talk
have
about
do with
Dr.
the
Smith?
sequence of
Maybe
events
because she's a big old
from
bee?
this point forward in the case, and what the evidence is going to show you about that sequence of events. This child was admitted with a consent form agreeing to treatment signed off by Mr. Kowalski on October 7th of 2016.
So he agreed to have his child kidnapped.
By
Okay.
that Sunday, the family, particularly Mrs. Kowalski, wanted to leave. They were being dissuaded from that. They'll tell you that on the morning of October 10th or 11th, that they were told they couldn't leave. I'm going to invite you to listen to what the evidence will show about that encounter. Because we believe the evidence will show, and you'll hear Mr. Kowalski say that no one ever told him he could not leave All Children's Hospital. We believe the evidence will also show that at that time, with the threats being made by the mother to find more high-dose, dangerous ketamine, that it was reasonable and warranted for the doctors to decline that if they had chosen to do so. We don't believe they did. We think that the evidence is more persuasive and shows you that there was a convocation of folks on the morning of October 10th or 11th at which there was discussion of the plan, there was a discussion of the weaning, there was a discussion of stabilization. The plan being, let's get her weaned off this medication safely, and then let's transfer her to an institution where more intensive physical therapy, more intensive behavioral therapy, and more intensive occupational therapy is available. The evidence will show you that All Children's Hospital was not trying to imprison this young lady. We were trying to get her stabilized and transfer to somewhere where she could get the help that she needed. And you're going to see that somewhere was identified by Dr. Michelle Smith and others as Nemours Children's Hospital. A brief look at Dr. Smith's qualifications. You're going to hear from her from the witness stand. Dr. Smith is presently our chief of staff. She's also a board certified pediatrician and intensivist. She came into this case on October 9th,
Can me and
And she-
Gunner go in the forest?
virtually from the outset, began discussing with Mrs. Kowalski transfer of the patient. Now, there's her plan of care. That's what she wanted to pursue. And she tried to get it done with a transfer from PICU to PICU to Nemours. She felt at the time that if she transferred the child to Nemours, the intensive pain management program could begin while the child was still an inpatient. Nemours declined the transfer. She didn't stop though. So I'm going to skip past this slide because we pretty much covered it. She didn't stop. After that discussion at which the family agreed to stay, and you're going to see multiple sources of documentation of that. After that discussion, she took it upon herself to call Nemours again. And she called a doctor named Lisgelia Santana Rojas. You're going to hear that Dr.
He
Santana
practiced that in front of a
Rojas,
mirror.
and you're going to hear from her, we believe, by Zoom. You're going to hear Dr. Santana Rojas verify what she was told or what she told Mrs. Kowalski and what Dr. Smith will say she told Mrs. Kowalski. And that's basically this. She said that Nemours wouldn't take a transfer for inpatient, but that Dr. Santana Rojas operated an outpatient pain management clinic, specializing in pediatrics because that's all Nemours does, just like all children. All we treat is pediatrics, all they treat is pediatrics. In their pain management program, they treat CRPS. You'll hear Dr. Santana Rojas describe that she told Mrs. Kowalski that. You'll hear her say that she was asked by Mrs. Kowalski, if I go over there, if I come to your program, will you put in an intrathecal pain pump? And Dr. Santana Rojas said, no, we won't do that. That's not part of our program. That's dangerous. It's against your daughter's interest. But what we will do, without ketamine, without analgesic, what we will do is give her intensive physical, occupational, and behavioral therapy. And I'm going to replicate with her the program I trained in at Boston Children's Hospital, Harvard Medical School. I've replicated that program here, and we're getting very good results. If you bring your daughter over here as an outpatient, we'll put her in our program. You hear Dr. Smith pretty much tell you the same thing. I'm not sure what Dr. Santana Rojas is going to say about this, but I know what Dr. Smith's going to say. And it's this. Dr. Smith left the hospital that day thinking she had a deal. She thought, okay, we're going to get this child weaned and stable, and then we're going to transfer her as an outpatient in her family's custody to Nemours Pain Management. Now, as you hear the evidence come in, you are going to see that at this point, on October 11th, 2016, there had been a report accepted to DCF. There had been an investigation started, but nothing really had taken place. There had not been a dependency petition filed. There had been no court order. The court hadn't denied the Kowalski's access to their daughters. They hadn't done anything. At this point, on October 11th, All Children's Hospital and its staff were attempting to facilitate Mr. and Mrs. Kowalski taking their daughter out of All Children's Hospital in their custody and taking her as an outpatient for treatment at the Nemours.
Hmm.
We suggest to you that if that had happened, we would not be together today.
So it's DCF's
We're
fault.
going to suggest to you that the evidence will show that if that had happened, it's reasonable to think that none of this would have occurred. We believe that had that occurred, this entire matter could have been sidetracked and never brought us together. But that's not what happened. Because the next morning, when Dr. Smith arrived back at the hospital, she found that Mrs. Kowalski wanted to take Maya Kowalski to Dr. Hanna for more ketamine, that she wanted to seek an intrathecal pain catheter elsewhere, that she wanted to obtain more ketamine elsewhere, and that there was still discussion of Mexico or Italy. Shortly after that, there was a shelter order. At that point, the circumstances under which Maya was a patient at All Children's were not dictated by the hospital, they were dictated by the court and DCF. Now, the situation proceeded with the weaning completed at All Children's. All Children's, the evidence will show, attempted to get this child the physical therapy on an inpatient basis that it could provide. We didn't think it was enough, but we did what we could. She got some behavioral therapy, although not the kind that she needed. We didn't have it available. That's why we wanted to transfer her. But you'll see as you go forward and you hear witness after witness and you look in the hospital chart, you're going to see that over and over and over again, we weren't warehousing this child voluntarily. You'll see it noted over and over. Medically cleared for discharge, awaiting court disposition.
Oh, it's not your fault. It's the state.
At the close of all the evidence, we'll tote up for you the number of times that appears in the record. But we're going to suggest to you the evidence is going to be conclusive that there was never any false imprisonment of this child at All Children's Hospital. Now, I want to talk, before I get into disease versus syndrome and problems with diagnosis, I want to talk about a couple other things.
I'm about to lose my mind here.
One is the matter of a battery and surveillance. We believe the evidence is going to show you that whenever there was a touching of Maya Kowalski, it was done for therapeutic or clinical reasons or to
Please
comfort
explain
a
to
child.
me why you
There was
touched
never
the child
any
while she
intent
was
to
in
do her any
pain.
harm. There was never any intent to be offensive or harmful. And we believe that at the end of all the evidence, you're going to find that there was never any point at which a reasonable person would have taken offense at how she was touched and how her care was managed in that regard.
I can't with you, sir. Again, you had her undress and told her if she didn't do it, she couldn't see her family. You told her to take pictures. You told her it was all in her brain. And I swear to God, if you say CRPS is not real, let's continue. I want to hear the rest of your dissertation of bullshit or dissertation of dog shit.
Need to talk a minute about the problems with diagnosis here. You're going to hear a lot about CRPS, conversion disorder, a number of other things. CRPS and conversion disorder and these mental diagnoses have a couple of things that are significant about it. One is that they aren't diseases in the sense that doctors use that term concretely. A disease is something that you can see and you can diagnose, and there isn't any question about it. Appendicitis. most forms of cancer.
Dipshittery.
There's the lab test that proves it or disproves it. If you have HIV, there's a lab test for it. If you have appendicitis, there's an imaging study that shows a hot appendix. Objective. Syndromes aren't like that. In a syndrome, you piece together a constellation of symptoms and a constellation of findings, and it's much more subjective. And that's why we have things like the Budapest criteria that council talked about, and you're going to hear a lot about that going forward. In this particular case, you're going to hear that there was a good deal of controversy about what this diagnosis was. When this patient came into All Children's, we did in fact admit her with a diagnosis of CRPS. And we continued to bill for that and to treat that, and we tried to transfer her with that diagnosis. But as time went on, for the same reason that CRPS was not suspected at Tampa General or at Lurie's or elsewhere, we questioned the diagnosis. And while the diagnosis was carried forward as a rule out, it was not the discharge diagnosis, although we noted in the discharge summary that it was never ruled out. Now, you're going to hear much about CRPS, but I'm going to skip past this slide because we kind of covered this. You are going to hear a lot about CRPS's rarity, and you're going to hear a lot of reasons given why we didn't believe this is CRPS. One reason was that it was presenting as a general pain syndrome involving the entire body. What's the name of the syndrome? Chronic regional pain syndrome.
I'm glad you can read, sir.
Doesn't usually
I'm
present
proud of you.
this
I'm
whole
sure your
body.
mom
You're
is
going to hear
happy
that's
too.
vanishingly rare, if not almost unheard of. You're also going to hear that there are various presentation factors about this disease that were never really observed on a consistent basis.
Yeah, but you tested
Decrease
her.
of hair loss, nail changes, skin asymmetric tissue changes in the skin. A lot of these observations about CRPS just weren't consistently present. There were, however, reasons to suspect conversion disorder. Now we've arrived at psychiatric or psychological issues. There's a lot of misconceptions about psychology and psychiatry.
So then you
And
just
mental
tell her
illness.
she doesn't have it and you tell her she's crazy.
And people act like saying it's conversion disorder or it's all in your head is some kind of epithet. It's an insult. That's not the case. When these doctors are writing down conversion disorder, they weren't trying to insult somebody. They were trying to attach a suspicion and a diagnosis to get a patient the help they needed. No one's telling this patient she doesn't have pain. What they're saying is that what their question is what's causing it and what you do about it. And that's the central issue here in many respects, because this entire case revolves around not so much what the diagnosis is, but what the clinical treatment is. I've got a slide here in a minute that will show you this, that I'll probably skip when we get to it because now I'm taking it out of order. Because as usual in an opening statement, I'm way off the reservation from what I'm supposed to be doing in order.
Sir, you should have been on the
But since
reservation,
it's
not
appropriate,
come
I'll
here
say
and
it
just
here.
settled out of court
When
like
you
not
look and when
dipshit.
you hear what the evidence is about the reasonable standard of care treatment for CRPS, for conversion disorder, for a pain syndrome manifesting as Munchausen by proxy, for factitious disorder manifesting as a pain syndrome. When you hear what the treatment is, the clinical treatment is for all those things, same thing. Maybe
Allegedly
the
a boot
mix
punch?
differs, but it's basically physical
Allegedly.
therapy occupational therapy, and psychological or cognitive behavioral therapy. Those are the treatments. And you're going to hear from experts who treat this disease day in, day out, and these diseases, I should say, all of them, day in, day out, and they do it without putting the patient in a coma, without giving the patient 15, 20 times the recommended dose of ketamine over months and months and months. They do it by therapy, and the results they get are stellar. And you'll hear that from them. You'll also hear that for that same set of reasons, this business about billing just isn't supported by the evidence. You're going to see the billing records. You're going to see the billing sheets. You're going to see that CRPS was an item. It was one of a number of items that was being billed for. You're
Yeah,
going to hear
you charged them $500,000.
that
I
there
think.
was no change in the
God, I would
medical
hope you-
reimbursement for the billing as a result of where, in what place, whether it's 1 or 12, and that's literally how many diagnoses there were at points in this, whether it was the first diagnosis or the 6th or the 8th or the 10th, you're going to hear that the billing reimbursement never changed. And the reason for that was that while you needed a diagnosis to put on that code, what was really being billed for was the services rendered. And you'll see the billing sheets and the services that are laid out
Yes,
item by
prison.
item, and you'll see that those didn't change either. You'll also hear that none of this cost Mr. Kowalski a dime. And you also hear that the insurer who was billed for the services rendered by All Children's Hospital for 3 months of inpatient therapy, the insurer never complained.
Well, that's right,
Didn't say
Christian
a word.
of them.
Approved the care, approved the billing. No problem.
It's right kindly of them.
Now, you're going to hear a lot about Munchausen by proxy, and I'm going to kind of fast forward through this for one reason that we're running a little bit low on time. But the other reason is that it's a very technical thing, and it doesn't merit near the attention that it's gotten because it's been a flashpoint throughout this. There was a suspicion of Munchausen by proxy. It wasn't just All Children's suspicion. There was a concern that part of this child's condition was being fostered or encouraged by the mother. There was a concern that the mother was seeking out care that was too aggressive, that was dangerous, and would persist in doing so if she were permitted to do so. That's what got this ball rolling. And I told you a few minutes ago what the evidence will show about the attempt to transfer for outpatient care, why it failed, and why, as a result of that, these investigations rolled forward. This is a slide I told you I'm going to skip because this talks about what the therapy is and how it is all of them. We talked about billing fraud, so I'm going to skip over this slide as well. Let me talk about photographs for a minute. You've heard about the photos that were taken.
Yeah,
These photos were taken for clinical reasons.
against
We
her
believe the
will.
evidence will show you that they were taken pursuant to the consent that Mr. Kowalski signed when he was admitted, and which he will, I believe, admit to you he never rescinded. The purpose of the photos was to document the condition of the child. If there were skin lesions, even if they were not being documented in the nursing notes, they needed to be documented. They needed to be observed if they got worse. If there were new ones being developing, we need to know that too. But the point is that they were being taken to assist in diagnosis and follow the child's condition. You heard about Surveillance, the movie, surveillance video. You're going to hear But that wasn't a new idea either. That also happened at Tampa General. Why was it done? Because medical professionals wanted to know what the child's capabilities were. Now, that video is going to tell you a couple, you're going to see, we're not going to ask you to watch 42 hours of video. But you're going to see grabs from that video that show several things from our standpoint. You're going to hear some of the plaintiff logs. From our standpoint, you're going to see in that video that Maya Kowalski, who's saying her legs are hypersensitive and can't be touched, saying she can't move her legs, is moving her legs in bed, moving her legs into a position that we used to call Indian style, and now we call crisscross applesauce.
Because you giant dickhead moron, as the MFer just before you said, it is not all the effing time. Now, had you had the cognitive ability to listen and learn and retain, you would have listened to that and learned and retained it. But you can't, so I will explain, narrate it again. Yes, the hypersensitivity is not all the time. It can happen out of the blue at any moment, but generally for me, and this is just for me, my hypersensitivity usually happens if I'm overstimulating my nerves. Say I'm doing desensitization therapy, so I'm going to go in knowing I'm going to mess with my leg. So I'm rubbing a towel on it extensively. I'm going to put the TENS unit on, let it run for 10 minutes or 5 minutes, or, do any sort of sensitivity training, or if there's a strong breeze, if there's cold breeze, even like that, there's an extreme sensitivity. Like if you're getting out of a car door, I have a sensitivity there if there's a cold breeze that comes up. But not all the time. Like my son can run into my leg sometimes and I'll be okay. Other times he can just run past it, and if that breeze hits it just the wrong way, it can be a full body leg spasm kind of thing, and I'll just lock up for a second and I'll need to take a minute. Sometimes I have to go back to my room and it goes on into a full-on flare. Sometimes I can just, relax. But again, it's not all the time, dependent on everyone's, pain cycle threshold kind of thing. Like right now, here, let me move all the things and get invigorated. All right, so right now, let me see if you can see my leg. From here to here, my leg feels fairly numb, but frozen numb. Out through here, I can feel it, but I can't really feel it. It feels like level 2 frostbite right now. If my son were to come and slap it or something, I'd probably go into a full body spasm right now. If I were to have my fan on, because my fan's always on, and it were to breeze onto my leg, it would not be very comfortable at all. It would be uncomfy. That's probably why I have my skirt up. I'm showing my legs, as you do, because it's a little not good. And that's why I buy my skirts about a size and a half too big, because it's a very loose legging. I do have, look, that's why I buy the Pentecostal sport skirts, because they have the leggings built in, but I buy them bigger because there is no world in which Mo does not have chub rub or thigh. There's no world in which Mo has thigh gap ever. It's never going to happen. There's never been a world in which that's going to happen. But the thing is when he's talking about this surveillance thing, we only have 6 more minutes of his babbling. Thank you, Jesus. It's not all the time. And that was the mind F for me at first, is that it wouldn't be all the time. So you have good days. And I kind of explained this with the other, we'll go Board of Truth again. Thorbert, I swear, if you mess my cross stitch up, this is why you can't have nice things. Got Thor under the cross stitch and Thor there. Thor. But for me, and like I said, I can only speak for me. So on a good day, I have a baseline of about a 4 or a 5, and that's on the pain scale. If you go to the doctor and you have the, for the love of all that is Cheetos, cat ass. From the, 0 pain to the sad face, which is 10, all the pain. I stay at a level 4 to 5. Which is I never wake up out just no pain in my leg. It's always at a level 4 to 5. And what they recommend is you get as much movement, exercise, range of motion stuff, regardless of stop showing your butthole. Yeah, I know, Thor. Yes, you were the star of every show before the mutt hole came along. Yes, I know. We all love you. You are Thor. Now, what happens is that you can have stimulus trigger, and you can go very quickly from a 4 to a 5 to a 9, 10 very quickly. So say I know when a storm's coming through, I'll tell, you guys, and I'll say, oh, look, you guys, a storm is going to come through. I may not do nightly newsy news. Because if a storm comes through, I can very easily be at a 9, 10 within hours. For the love of all that is Cheetos, I cannot have nice things. You have do you not see your entire nice cat condo that I put together? He says, yes, but I'd like to just be. So, and it's not like a gradual, it is like this. It doesn't, so when he's saying, okay, well, she can move her legs now, she can do this and that. When I explained to you guys what happened on Labor Day, so I was at the pool with Mr. Mo doing all the things. I had been sitting in the sun, and I decided I could sit and I could go into the lake with my mom, and I could put my leg in the water. And after I got used to the initial cold shock and had the leg spasm from the water cold shock, I was doing fine. My leg adjusted and I could do stuff. So I thought, I am going to, I was kind of excited. I was like, I want to put my leg in the pool. What I hadn't accounted for is that I hadn't been really sitting outside this summer. So my leg was not used to the extra stimulus of the sun. It also wasn't used to the extra stimulus of splashing. So, those moments when you sit down and you're like, you have done screwed up. So I already sat down, and I realized right at that moment, the water started splashing and it started really hurting. And I realized I have to get up. I have to go sit down, and I'm going to have for the love of all that is. Yes, I love you so very much. Come here, you giant cuddle whore. But I realized I was going to have a flare because of the stimulation, and all of that stimulus hurt. The sun hurt, the breeze on my leg hurt. After I reached that stimulation threshold for me, everything hurt. So I don't know about her. I can only speak to me. But if you are predisposed during that day, during that time, for whatever reason, because CRPS is a giant asshat, if you reach that stimulus, threshold, and you've just done it, it can flip that signal on, and you can just start having a full-on flare-up. and it just is what it is. So that's my only explanation. Like I said, I can only speak for me, so I don't know because hers is they are correct. Usually it presents in a limb. It's very odd to have it in present as a full body thing. It's fairly difficult. That's not something that normally presents as such.
She was able to assume that position and hold that position voluntarily and without a problem. You're also going to see and get some idea of the fact that she was not in that room.
You are such a cuddle whore.
You'll see
Oh.
that she's in and out. She went to therapy.
No, you're fine. You can do that. You can offer a counterpoint. Sure. I want everyone's opinion. Like I said, I am going to be beyond bias. So I am fine with everyone offering other things because I am, like I said, I am biased. But I do think that the mom might have been, look, you get an idea in your head and maybe you just run with that and run with it and run with it. So yes, I am open to counterpoints. I'm just not open to him saying anything. He done pissed me off, but anyone else can counterpoint away. This lawyer just done irritated me. But we'll let him babble for a little bit longer.
To therapy. She went to other places. And you'll see the nurses coming and going and assisting her when indicated to the commode. The commode wasn't placed out of her reach for any kind of malicious purpose. It was placed in the position that it was because she had nursing staff available to help her, as you'll see they did. And because if you put it too close or in too close position to the bedside, it would obstruct the nurse's ability to get to the bed. It was strictly a matter of happenstance. It was not a matter of intent. And that brings me to another point, and it's on this slide. You're not going to hear any evidence that the 50 some odd medical doctors and professionals who took care of Maya Kowalski over 3 months somehow banded together in some sort of cabal and hatched a plot or a conspiracy to do harm. You're just not going to hear that. You're instead going to hear from a constellation of dedicated pediatricians and dedicated specialists who were genuinely trying to do the right thing to this patient. They may have differed in some opinions with the family, but their uppermost objective was to keep this child safe and to get this child the therapy and the treatment that she needed. Now, why was the diagnosis an issue if the treatment was the same? That's a reasonable question. Let me suggest to you that the evidence is and will be.
I have a question. Why are your glasses on your head if you never intend to use them? You have a pocket, sir.
That the importance of the diagnosis is the result of the fact that CRPS diagnosis was being used to justify dangerous care, dangerous levels of ketamine and other drugs that aren't even recognized in the literature. Those doctors weren't going to come get the patient. Family was going to take the patient to those doctors. And so it was important to get the diagnosis straight and the treatment straight so that the right mix of therapy could be formulated and the best job could be done to get Maya Kowalski into a position of being comfortable, functional, and lead a happy and healthy life. That's what we were attempting to do. There's never an intent to do anything but that. Over the next few weeks, we think you're going to hear a number of experts in the courtroom We'll be bringing in experts
I'll allow
from
it this way up.
California and elsewhere.
I just don't like this man, so
They're going to talk
he
to
annoys
you
me.
about whether or not the overarching allegation against All Children's and its physicians, including even Sally Smith, that they were negligent in Maya Kowalski's care and that their negligence somehow caused injury. We're going to suggest to you that, first of all, there was no ultimate injury caused, given the condition that she was
Oh, none
given to
whatsoever.
us in. But more importantly, there was no deviation from the standard of care. You're going to hear from different doctors in different specialties that the care that was taken in diagnosing and treating Maya Kowalski, you're going to hear about teams of consultants. You're going to hear about meticulous investigations. You can see that Sally Smith formulated a 45-page single-space report of her review of literally thousands of medical records to come up with her diagnosis. You're going to see a lot of effort and care and expertise went in to the effort made to treat this child at Johns Hopkins All Children's Hospital. We believe that the evidence will be unequivocal. That degree of effort, insight, investigation, and monitoring and care comported in every respect with what is reasonable and what is recognized as being reasonable.
Is Alienware holding himself back? Because he just did that deep breath, like, hold me back, hold me back. Or is he
and
just
appropriate
stretching?
by other similar physicians. And we don't believe you're going to hear any
Because
credible
that's a
evidence
side
otherwise.
eye right there.
You heard the judge give you a definition of medical negligence. I just kind of paraphrased it. But the point I'm making to you is that the evidence will ultimately show that these doctors and these nurses and this hospital staff acted reasonably and prudently to treat a difficult and challenging case they were presented with, and they did it consistently over 3 months. They don't have to be right under the law. All they have to be is reasonable. We will suggest to you the evidence will show that, first, they probably were right.
Oh,
But
well,
even
I'm
if they
glad they were
weren't,
probably right.
they were more than reasonable. At the end of all this, at the end of all the evidence, I'll have another chance to visit with you, or my colleague, Mr. Shapiro, will. You're going to hear a lot between now and then. And again, I appreciate very much your attentiveness and your diligence, as does my client and people at All Children's Hospital. I thank you for your attention and look forward to working with you in the next few weeks. And you'll be pleased to know I skipped at least 3 slides. Thank you.
Well, we got through that without drinking. Thank you for being my emotional support, not vodka, Kat. Were you sensing my rage, or did you just want to be held while you slept? So that was their side of the story, and putting on my generally non-biased hat, which I sort of can, I I can generally, oh my gosh, look. So the other cat has stolen Fry's bed on my bed. My room is a mess. This is why we can't have nice things. I've got cats crawling all over the place. I've got a dog asleep on the floor. It is chaos. It is chaos and mayhem and shenanigans. Fine, cat, if you just would move for 5 seconds. I don't know why it is I can't have nice things. I can't imagine why I tell Mr. Moe I would like just a panic room. it's almost unbelievable. But that was his opening statement, and like I said, as I can put on my absolute non-bias hat, I can say that the mom does seem rather militant. She does seem rather bossy, rather set on her idea of what the treatment was supposed to be. I want to get through my treatment as much as I can without the use of narcotics and things like that. You know, she had the overarching feeling that she was right. And look, I get it. She was fighting for her daughter. She probably should have been in counseling. For someone who jokes about counseling as much as I do, the mom had been through a trauma of having a medically complex daughter go through a lot of medically complex things in a short period of time. She should have probably seen someone to deal with that kind of trauma. And she probably had a trauma reaction when, you know, they had thought that things had been taken care of, and then she has a major flare up. So, you know, she could have been having a trauma response. She went full on catastrophe mode and just could not get out of that kind of mode. And then you had the trauma of, okay, well, now you can't get your daughter back, this, that, and the other. And she just went, you know, she just went too far. And then everything happened and snowballed. So I can see both sides. I really can, guys. As much as I joke about, you know, the pettiness, and I really will never understand why he had to add that one particular line about if we had done, you know, if the mom had agreed, we wouldn't be here. I found that to be incredibly, incredibly poor taste and incredibly just awful. Oh, thanks. Well, that's good. At least one teenager really likes me. I always tell my kids, I was like, you know, at least almost 400 people like to listen to me because my 6 kids rarely do. And my puppy sort of does. And my cats, well, sometimes do. But I'm going to get off of here and make sure that the feral children are still alive-ish and rotate laundry because my life is glamorous. And then I'll probably pop on to Nicholas's Shat Faced for Charity or Charity for it's something with charity. I can see both sides, but I still think that the hospital is in full cover your ass. Aren't we the reasonable ones? Look at how crazy this chick was. They're presenting the facts, but they're not presenting the full facts in a way. And I hope that I think Maya is smart enough and is going to be able to communicate in a way that is kind of like me. I think if you have a person that has it and that can communicate calmly, rationally, and in a way that kind of bridges that gap, because right now what he is saying sounds completely reasonable. Like, look, they were just touching to offer comfort. When Maya says, "When you touch me, it feels like rubbing sandpaper in an open wound." Well, then that shines an entirely different light on it. That is like, okay, well, that brings a whole different light on it. So I think hopefully when Maya testifies, when the family testifies, and then when her experts testify, it will bring probably in a little bit. I do have to take the Frybert out. I have to uh, remind Mr. Mo to pick up youngest daughter and a couple other things, and then I will get on with Nicholas for a little bit, and then I am going to join Flux for fluxing around and doing some cross stitch and just fluxing around tonight for a little bit. And then tomorrow I've got the murder board for Gareth and who knows what for this weekend. I might go up to Delphi. I might not. It depends. There's rain coming in. We never know. But there's always stuff to do. And it looks like Someone has been arrested because I am a news nerd and I've got everything popping up. Someone has been arrested for the murder of Tupac. So we will see. Have a wonderful rest of your day. I will be on Nicholas's in a little bit, and I will see you guys there. Thank you guys for joining me. This is going to be a long trial. I'm going to do it kind of piecemeal. I may not be able to do this every day. There is an emotional component to CRPS. It's a parasympathetic nervous system. So on rough days, like with Maya and stuff, I will try to have it in the afternoon. I can have Salbert on or someone else. Um, just to have someone bounce off. But I'm going to, try to continue to do other things. It's going to be a longer trial, but I might have to take, if it's a rough day, like when Maya goes on, I might have to take her in several days. That's just kind of a public service announcement, but that's how it is. I will see you all in a little bit. Bye, guys.